So today's talk is going to be on medical school application process. Really a little bit more as well about medical school, what it is, why you might want to come to medical school, why you might not want to come to medical school. But yeah, any questions you have, please feel free to pop them in that Q&A box. So who am I? My name's Ella. I'm currently a final year student at the University of Manchester, so just around the corner now from taking my finals and graduating. If any of you are struggling to see my slides or myself, or struggling to hear me or anything, just put it in the Q&A box as well. I've got to say that. But hopefully you can all see them. Yeah, so I'm a final year medical student at Manchester. I'm about a month away from taking my final exams, and then hopefully I'll be a junior doctor by August. In terms of what I'm interested in, I really hope to go and be a paediatrician one day, in particular working in emergency peds, but I also have an interest in education in general and in particular medical education. A bit about my journey to medicine. I joined medical school straight from school. I didn't take a gap year. Manchester was my first choice. I was lucky enough to get an offer and I got the grades I needed to go in. I'm not from a medical family. I was the first person in my family to be medical at all. So it was all very new to me. I didn't really know what I was going into. I didn't really know how to apply. So if you have any questions about sort of coping with that, then feel free to ask them. But yeah, my journey wasn't that interesting, but I have many friends who've joined medicine through many different routes. So any route you're curious about, I should be able to answer. But yeah, that was just a little bit about me. So to start off with, just thinking about, is medicine for you? I'm assuming because you're here, you are definitely interested in medicine, but some of you might not yet have done any work experience or might not know much about medicine. So we'll just talk a little bit about why you might want to go into medicine. There's loads of reasons why someone might want to do medicine. The most common one you'll hear people say is helping people. You do get to work with loads of lovely patients and you do genuinely feel like you're making a difference, which is really nice. Every day is something new, especially in medical school when you're spiraling through your different placements. Lots of careers within medicine. Actually, if you have a medical degree, you can go into like politics, you can go into purely teaching. Businesses sometimes need doctors. There's loads of different types, and even within medicine there's many different specialties. Radiology versus emergency medicine is very different. You can also work in labs or work in research. A chance to be the leader of a team. Lots of problem solving. Diagnosing really is just problem solving. You get to actually really use your brain, which is nice. You're an expert in your field. This is what makes medicine different to some of those other healthcare professions. You are really like top of a class. You know your stuff and people come to you when they need advice. Other medical students and doctors are absolutely amazing people. A lot of them really nice, really just there to help people. Very funny, very social people as well, which is great. Yeah, opportunities to do research. And depending on what medical school you go to, you have an opportunity to do lots of essays or no essays, depending on what you like. At Manchester, we don't do essays. We do one essay a year and then no essays in fourth year. We're doing an elective instead. So if you're not one for doing written work, then medicine might be for you. It's much more practical. Thinking about why people might not suit medicine so much, it can be incredibly stressful, both medical school and the career. It can be very like anxiety inducing. There's a lot of work. Not so much in your first few years, although you guys might find it a bit of a jump from A levels, but by the end of medical school, you'll be doing full-time placements on top of revising for quite big exams and learning lots of new content. So that can be a bit of a shock for some people. Lots of antisocial hours. Again, in medical school, when you think about having to revise quite late into the night, but especially as a doctor, you're going to have night shifts, long days, etc. It can be quite emotional. You are, if you go into this field, you will see people pass away, unfortunately. You might be asked to attend crash calls. which is, you know, where you need to give CPR to somebody, and they might not always survive. You might also see quite unwell children, and cases as well that resonate with yourself. Let's say you have a family history of cancer, for example, and then you have to sit in a cancer clinic. That can be quite emotional and difficult. The degree is very long. It can be a bit difficult when you get to your 4th and 5th year, when you're seeing all your friends from school fly the nest, fly away from university, get their own houses and jobs and things. That can be quite difficult. And you have learning and exams many years after medical school as well, exams all the way up until you're a consultant. So that can not be for some people, I think. If you're really unsure still, make sure you get work experience. I know at the moment with COVID, ever since COVID, it's been difficult for people to get clinical work experience. Message your local GPs. They're often really good sources of work experience. Hospitals sometimes have programs, even work in like vaccine drives, these kind of places, care homes, if you can get into them, and it will give you an experience of what it might be like working with patients. See if you really like that patient interaction, or maybe it's not for you. Read books. So Adam Kay has a good one called This Is Going to Hurt. It's very honest. I know people it's put off medicine. I know people who have become more interested in medicine after reading it. It's basically the diary of a junior doctor. A little while ago now it was written, but it is a fantastic book. There is also a BBC show based on the book, which is a little bit more dramatic, but might also give you a bit of an idea of some of the difficulties you'll face as a doctor. There are other good books out there that you can read as well. Online courses, again, run by medical students, giving you a bit of an insight into their life. Talk to medical students. If you meet a medical student or you're on a call like one of these, and you have the opportunity to ask questions, please ask us. We're really passionate about what we do, passionate about helping other people as well. So if you do have questions, we are absolutely happy to answer them, sorry. Even if it's something stupid or you think it's something stupid, it might be like, what's the social life of a medical student like? How do you cope with having to learn to cook and clean on top of, you know, studying medicine or whatever it is? We're always happy to answer it. We're happy to be very honest with you as well if you want to know what we personally struggled with or found particularly great about our course. So yeah, really, whenever you meet a medical student or a doctor, take that opportunity to ask loads of questions. So a little bit of an insight into what it's like studying medicine. Most universities split their degree up into preclinical years and clinical years. In Manchester, we do 2 preclinical years and then 3 clinical years. Preclinical years is before placement. You might have some early clinical experience where sort of once a semester you go into a GP or a hospital. But mainly you're based at your university. You might be doing PBL or lectures depending on what the teaching at that university is like. But yeah, so first 2 years, mainly preclinical, more like a normal degree. And then in your last 3 years, you'll be mainly based on placement with supplementary teaching on top of that. I'll be honest, clinical years are much more exciting than preclinical years. Most people enjoy them a lot more. So this is I've got some examples of some timetables. These are my own timetables. I have the black marks are just people's names that I blocked out. Unfortunately, I didn't block everyone's names out. I wasn't paying attention clearly well enough. So this is an example of one of my timetables. This one's from first year at Manchester, just to give you a bit of an idea of what kind of things you might be doing in the week. So Manchester, we're a PBL university. I'll go into PBL in a moment. But this is just an example. So you might have had a PBL session on Monday, you might have a histology lecture, so that's looking at like different cells and how that affects disease. You might then have dissection. So in Manchester, we have full body dissection. So you might have 2 hours of that on Tuesday, followed by a couple of lectures, more lectures on the Wednesday, and then PEP is a sort of project that we do at Manchester, like a research project kind of thing. And then might have physiology and pharmacology, so looking at medications and how they affect the body. They might have another PBL session on the Friday, and then introduction to respiratory exam here at the bottom. So that would be a communication skills session. At Manchester, we have 2 hours of communication skills every week. So that's a pretty standard timetable for first and second year, and all these empty gaps are where you would do your PBL learning, your extra learning. It's where you do your essays if you're at a more traditional university. You might also have things like societies, sort of commitments going on as well. Whatever it is, revision for exams that come up that you do in the meantime. But yeah, that's a pretty standard first or second year timetable. This is what my timetable in third year used to look like. This was when I was on placement in general surgery at Oldham, as you can see. And it might look like this. So I'd have like a ward round in the morning, and then I'd have some teaching in the afternoon, then a clinic on Tuesday with some more teaching. And then I might be in theatre on the Wednesday, and then more teaching on the Wednesday afternoon. And then, you know, just more like that throughout the day. And then on Fridays, that would be saved for university teaching. So this was on high blood pressure this week, you can see, with some prescribing teaching as well there. Year 4, much more. In Manchester anyway, we cycle through placements a lot quicker. We're looking at the more specialised areas of medicine. So this is a timetable from paediatrics, where, again, you get a bit of teaching, but you're mainly going to be on the ward rounds and in the clinics. You might have some ethics teaching here, as I did. And then Friday, again, in 4th year was mainly teaching, but with a little bit of placement as well. 5th year is a little bit different. Not as much teaching goes on in 5th year. You're more preparing for practice. You're more getting familiar with the life of a junior doctor. So this is my current timetable, actually, where pretty much full time, 8 till 4, I'll be working alongside the F1s. I might also be in theatre or clinics. And then you can see down here in the bottom left-hand side, the corner, some teaching that I might be given. We have things like simulations, which are where you'll put with, really it's like a mannequin, but it can speak, it can make breath sounds, to test whether or not I can cope as a junior doctor. So that's maybe more like what a 5th year does. So that was just to give you a bit of an idea of the kind of teaching that might go on, what your placements might look like. You can probably see in 5th year there's not a lot of time for revision, etc. So they do have to kind of go into your afternoons, and sometimes we have teaching in the evenings too, so quite long days. So thinking about what medical school might be for you, could think of a couple of different things. So location's one of them. Where do you want to go? Completely up to you. It doesn't really matter. Some universities are city, some universities are campus. What this means is a city university, a little bit more spread out in the middle of the city. Campus university, everything's closer together, all within the boundary of the campus. It doesn't really matter which one you go to, it's personal preference. Manchester's a city university. That's just what was more preferable to me. I wanted to enjoy city life. I wanted to be a bit more spread out. I wasn't that bothered about being near lots of students. Do you want to be near home or somewhere new? It's completely up to you again. Some people live at home, something that's easier for them. Some people want a complete new start. I moved quite far away from home when I moved to Manchester. But again, Manchester had good connections, so I could still get home if I wanted to. It was that ideal where it was sort of just far enough away so that my family couldn't pop in to see me whenever they wanted, but also close enough so that I could go home if I needed to. But again, completely up to you. It depends what you want. When you get to the end of medical school, you don't have much. I'm not sure whether you guys can still see or hear me. My thing's buffering a little bit. Yeah, completely up to you. By the end of medical school, you will be all ranked and placed in different parts of the UK. You don't have much choice as to where you end up. So you might feel like you want to get it out of the way sooner and get used to living away from home. Cost as well. London's more expensive than other places, that might be a factor that influences you. Thinking about large city versus rural healthcare, it is different. You're going to see more stabbings, things like this in a large city. You're going to see more diversity in a large city. But if in the future you're thinking, I'm going to live in a city or I'm going to live in a rural area, you might want to get that experience earlier. Again, it doesn't really matter. It's completely your own preference. Thinking about where you have to move for placement years. So for example, in Manchester, one of the bases you might be moved to is Preston. So if you're going, you might end up getting moved like an hour away from Manchester for your last 3 years. That might not be for you. So just think about looking into where you go for placement years. Also, some places travel further for placements than other places. If that's a factor for you, just research it and use that to decide. Really, location doesn't matter. Every medical school, by the way, is a fantastic medical school. And when it comes to becoming a foundation doctor, that they don't take in consideration what medical school you went to. It's just where you ranked within your own medical school. So going to Oxbridge is not going to give you any better opportunities than going to Manchester or going to Keele or wherever it is you're looking at. So in terms of teaching, there's 3 types of teaching. So the first one's traditional teaching. This is not popular anymore. Most universities have moved away from it now. You really only see it in those Oxbridge kind of universities. Even the London universities, not a big fan of it anymore, and they've moved away. But it's purely lecture based. You have loads of lectures in these ones. And it's very similar to how you'll be taught in school. PBL based, this is what I do in Manchester. It's clinical case based, so you're given a case and you work in groups of 10 or 12 to go through that case, pick it apart, think about what you don't know about that illness or about that presentation or medications or whatever, and then you go away, you research all the answers to the questions you've come up with, and then you come back as a group and discuss all those answers. If there was anything you didn't really know, you can say, oh, I didn't really understand this, and someone else will be like, oh, I've got a really good way of remembering that. So you kind of work together to build your knowledge. And this is how you will be learning as a doctor. You will be given cases to work through. So it's quite nice to already get used to that kind of technique early. Integrated is the most common type of learning at the moment, and basically a mixture of those two. By the way, with PBL-based universities, we do still have lectures, as you will have seen in my timetable, but just like less. So only about 6 hours of lectures a week instead of, I think sometimes it can go up to like 20 hours or something ridiculous in traditional universities. Also, lectures are optional in PBL based, whereas they're compulsory in traditional. Yeah, so most medical schools are now integrated or moving towards a PBL based teaching. Basically, if you prefer being a bit more hands-on, you're not so good at writing those essays, you like working as a group, you like seeing people's different perspectives on topics, PBL's for you. If you don't really feel comfortable with that and you want more set, writing essays, being given the work that you need to learn, then traditional might be a bit better for you. But it's completely, again, preference. A lot of people ask me, how do PBL universities make sure you've learned all the content? And you're given a tutor in each of your groups, and they make sure that you've covered everything you need to cover for that week. You're also given a bit like a spec like you would get at A-levels, so you know you've covered all the topics you need to. So that's nice. Yeah, so traditional as well, a bit more strong focus on science that underpins medicine, whereas PBL is more focusing on developing that clinical reasoning that you'll need when you're a doctor. Also, traditional tends to have less placements than a PBL university, but that's not a hard and fast rule. PBL based, yeah, clinical case looks like this. Someone writes on the board and you all have a discussion. It's very hands-on. Thinking about strategic application. So all of you are going to have strengths and weaknesses when it comes to applying to medicine. So think about, what are your strengths? Did you do really well in UCAT? If so, apply to UCAT universities. Think about, do they really consider UCAT heavily? If you've done well, you might want to go to one of those universities. If you've not done so great, maybe think about applying to somewhere which doesn't take UCAT as much into account. Again, BMAT, only applies for BMAT University if you think you're going to do well in BMAT, or you maybe apply to a BMAT University if your UCAT's a little bit weaker. Some universities really care about GCSEs. If you've not done so well in your GCSEs, don't apply to those places. Interview, all medical schools interview, but just look into how they interview, how they take that into account in comparison to your other the other parts of your application, and just think about, am I someone who is going to do well at interview or not, basically. And just remember, all medical schools are good medical schools. So if you apply somewhere, if you're thinking, I'm absolutely never going to get into Oxbridge, don't fret about it. They don't necessarily make the best doctors. There are fantastic universities, but all medical schools are good medical schools and are kept up to a certain standard. So you're not going to be a worse doctor just because you haven't gone to one of those universities. So don't stress about them. Other things in terms of teaching you might want to consider. Not many universities now offer full body dissection. So if that's something you really want to do, then obviously research it. Manchester, we do full body dissection. It wasn't for me. I'm not going to be a surgeon, but I'm really glad that I had the opportunity, that the first time I used a scalpel on a body, it wasn't on a real patient. It's also a really nice way of learning anatomy because you're really hands-on, really getting to experience it. If it's important to you, research it. There's only probably like 6 or 7 universities that still use it. Again, early clinical experience, if you want that, make sure that the universities you're applying to have that. Intercalation, most universities will offer intercalation, but just look into how they offer it. For those of you who don't know, intercalation is where you can take a year out of medicine to go and do a different degree. There is only a certain number of degrees you can do. Usually it's things like psychology, ethics and law, sort of medical related topics. And you do a 3-year degree within a year and you get an extra qualification at the end of it, obviously. Some universities will let you move to other universities to take that year. Others will say you have to stay at that university. Some have intercalation already sort of mixed in with their degree anyway. So it just comes in different forms in different universities. So if it's something you're interested in, just do some research about that. You don't have to intercalate if you don't want to. I personally haven't. It doesn't actually benefit your application to foundation year medicine sort of when you become a doctor anymore. So a lot of people don't take it, but if it's something you're interested in, just do some research. Extra qualifications, just links with intercalation. Course length in the UK, it can be anything between 4 and 6 years. 4 years if you have a previous degree, 5 or 6 years if you don't. It's completely up to you. If you want to do a 5-year course, you're not going to be a worse doctor because of it. You just probably have a little bit less clinical sort of scientific knowledge behind the medicine, I suppose. Really that extra year is mainly bioscience based. So again, completely up to you. Also really important to remember extracurricular activities. Medicine is very stressful. You need a good work-life balance. So thinking about what kind of things outside of work you might want to take into account. How good the university's medsoc is. Different medsocs have different levels of like hands-onness, I suppose. At Manchester, our medsoc is very, very good. Really encourage you to get involved with lots of extracurricular activities. And that's just really nice when you're new to a place and you need to meet new people. It's really nice to have that opportunity. Again, with medsoc, opportunities to get involved with leadership, if that's something you're interested in as well, just consider that. So I currently am president of a society in my medsoc, and I'm really grateful to have had that opportunity. Types of societies as well in the wider university as well as within the medsoc. Are you particularly interested in a sport? Are you particularly interested in music, whatever? Just look into what societies they have, see if they suit you. Nightlife, I think people get a bit scared about asking about this, but yes, medical students have lives outside of medicine, and if things like nightlife are important to you, you might consider going to a more city university. Days out, do you really like museums? Do you like ice skating? Whatever it is, does that university have those kind of facilities near it. Part-time jobs, not all medical schools are conducive with having a part-time job as well, just because of the hours that you are required to work. If it's really important to you to have a part-time job because you're not sure you're going to be able to get through medical school without the extra money, then just look into that. Ask medical students at that university, do you have part-time jobs? How does that work? Do they have any advice on that in whatever city you're in? But all of these things are very important as well to take into consideration. So you've decided medicine's for you, and now it's time to apply. So the dates you need to be aware of. So start off with writing our UCAS application. UCAS is the platform with which you're going to be applying through, most of you anyway. Then you take your tests, your UCAT or your BMAT, and then you have your interview, and then hopefully you'll get an offer, and then A-levels come after that. So we're starting today. In July, September-ish, you sit your UCAT, so it's kind of over your summer holidays. 15th of October is usually when UCAS application deadline is, and you'll have your predicted grades before then, hopefully, because it should go on your UCAS application. So between that time, between your UCAT and that application, you're going to be writing your personal statement. BMAT's usually in November. And then interviews usually come between November, February, sometimes a little bit outside of that boundary, depending on the university. And then hopefully you get your offers usually between February and May. And then you sit your A-levels in the summer. And then mid-August, you get your A-level results. And then hopefully you've got your results. And usually it's mid-September that medical school starts. So when we think about writing applications, so UCAS, you're allowed to choose up to 4 medical schools, and then you're allowed 1 extra non-medical application. I don't know why they do this. With all other courses, you're allowed to choose 5 of that course. Your non-medical application can be at a university in which you've applied to medicine. So for me, I applied to Manchester, Sheffield, Liverpool, Nottingham, and then I applied to Manchester for biomedical sciences. Usually that extra application is something medical related, usually biomedical sciences, but if you're interested in neuroscience or something like that, you can apply to those. You don't get a separate personal statement for that extra option, so just be aware of that. Yeah, you get 1 personal statement for all. Some universities will ask for a separate personal statement because they know that a lot of medical students apply to their biomedical science or whatever, so be aware of that. Also Manchester, I don't know where else does it, but Manchester ask for like a extracurricular form as well to fill out, which is a bit like a second personal statement, and you submit by mid-October. So that's really all you need to know, is that you're going to choose 4 medical schools and an extra one. If you literally only want to do medicine, and if it's not medicine then you're not going to go to university, you can leave that extra one blank if you want. So writing a personal statement, you need to include, they're 4,000 characters long. You need to include an introduction, which usually covers your motivation for medicine. So, traditionally that story of, I experienced this fantastic doctor when I was 6 because I broke my arm and they were fantastic. And then I thought, oh, wow, maybe I want to be a doctor. So you talk about your motivation. You need to make sure you include work experience. You can also include hobbies and things within it. Also things you've read, or, if you've done DOV, whatever, include that as well. And the main top tip for writing your personal statement is you need to cover what you've learned over what you did. This is really a whistle-stop tour of personal statements. I'm pretty sure 6Med are going to do a surgery on personal statements nearer the time. So go to that if you're freaking out about personal statements. But key point, what you learned over what you did. Don't just list your experiences you've had on work experience. Use very specific examples and say what it taught you and why that's important for medicine. So, saying, when I was working in my GP practice, I saw this really emotional patient. The doctor was really good at calming that patient down by using these set communication skills, and I'm going to use those communication skills when I am a doctor in the future. But that's really the key thing to know about personal statement. It's hard to fit everything you want into it, it's quite short. Really important though, guys, that you do work experience to make sure you understand about what life as a doctor is going to be like. It would be really difficult to go to medical school having no experience working anywhere. So I really do recommend that you do it. If you're struggling to get clinical work experience, things in care homes, any sort of patient interaction is great. If you're struggling to even get that, charity shop, work a paid job, anything, you know, take a leadership role at school, whatever it is you can do to build your skills is going to be beneficial for you guys. So there's no excuse to have no work experience, basically. Clinical if you can get it, but any long-term job is great as well. Always have one work experience, volunteering, job or whatever that's lasted quite a long time, because they do like to see continuation and dedication to a job. So if you spent a week in a GP, that's not good enough. You need also to have worked in a charity shop for a year or something as well. But yeah, you need to have work experience. It's really important for medicine. So thinking about the admissions test, UCAT's the one that most of you will sit. It stands for University Clinical Aptitude Test, something like that. Most unis use it. It's about a 2-hour exam and it's split into 5 subcategories. And it tests skill and time management over knowledge. It's quite hard to prepare for. You can just do practice questions, but there's not really any content you need to learn. And you get the grades as soon as you walk out the exam. They print it off and they hand it to you, so you know straight away how well you've done in UCAT. It's also sat on a computer. You usually go where you take your driving theory test, and you just sit on a computer. These are the 5 sections of UCAT. So verbal reasoning is basically a comprehension, decision making, test logic. Quantitative reasoning is a mathsy section, very, very simple maths, GCSE level or less. You know, addition, subtraction, multiplication, that kind of thing, graph reading. Abstract reasoning is pattern recognition, and then situational judgment is an ethics part of the exam. Sections 1 to 4 are measured in numbers. You're given a number out of 900 for each one of those, and then you're banded with situational judgment. So band 1 is the best, band 4 is the worst. And the universities can use these scores to sort of rank all their applicants. Usually UCAT's used before interview, so they'll take the top third of people who scored, you know, the top third of scores in the UCAT, and they'll interview those individuals. But yeah, you really just have to practice with UCAT. There's not really any learning you can do. Loads of great UCAT books. 6med will do UCAT crash courses and surgeries nearer the time. And UCAT's own website has good practice questions as well. So that's UCAT. BMAT is another test you might be asked to do, particularly if you're going to look at Oxbridge. There's a couple of others that still use it. BMAT has basically gone bust now, so unfortunately this is the last cycle it's being used for. So if any of you were thinking about applying to medicine in a couple of years, BMAT will no longer be offered. We're not quite sure what Oxbridge and the other universities are going to use. Some of them are going to move to UCAT, but some of them might introduce their own admissions test. But if you're applying next year, then you'll still be using BMAT. Yeah, not that many unis use it. They'll tell you on their websites if they do. Again, 2-hour exam. Split into 3 sections. There's an essay, that's the final section. They give you some essay titles, you have to write an essay. And then the other sections, one's kind of GCSE level science, so biology, chemistry and physics. And then there's like similar to the UCAT, it's the first section in BMAT, but it's very similar, it's sort of logic kind of questions. You only get your grades for BMAT after you've applied to medical school, so you don't actually know how well you've done at the time of submitting your application. So it's often recommended that you don't apply to just BMAT universities, because if you bomb it, then you're kind of screwed. So if you've done okay in UCAT, then you might want to apply to 1 or 2 UCAT universities and then BMAT for the rest of them. For interviews, there are a couple of types of interviews. So panel is one, it's not used that often anymore, but some universities still use it. You have one interview, which is done by multiple interviewers. There's usually 3 of them. And there's some question variety, but they're often quite academic questions, a little bit more boring, motivation for medicine, quite standard questions. Yeah, same interviews for all of the questions. They're quite long interviews as well, a couple of hours long, but not very commonly used anymore. MMI stands for multiple mini interviews. This is what's more commonly used. It mirrors exams that you have in medical school are now called CCAs. They used to be called OSCEs, but practical exams. You're given between 5 and 10 different stations that you cycle through, and they are very short. They're often between 4 and 10 minutes long. And they cover a wide range of topics. So you might have one on motivation for medicine, one might be more academic, one might be an ethics station, one might be a role play, and you go through all the different types. Each station has a different examiner. This is great because if you mess up on one station, you move on to the next one and they don't know that you've just said something horrific in the last station. They're going to mark you separately, and just failing one station doesn't necessarily mean you're not going to get an offer. So that's great. MMIs are great, but that's probably what you'll be sitting. Different types of stations can come up. So academic, you might be asked some science questions, some maths questions. Drug calculations come up quite commonly. Things like they'll tell you the dose of this drug is, 10 milligrams per kilogram. This patient weighs this many kilograms. What's their dose going to be? Relatively simple maths usually, but yeah, these don't come up at every interview. They're fine when they do usually. You're always going to be asked questions about yourself. So you might be asked about your extracurricular interests, how you maintain a work-life balance, hobbies. You'll almost definitely be asked about experiences you've had on your work experience. With work experience, when you're preparing for your interviews, make sure you keep like a diary of your work experience, because they're going to want you to talk about very specific examples of things you experience. So they might ask you something along the lines of, give me an experience on your work experience where you saw really good team working, for example. So make sure you keep a diary of your work experience. They'll ask you, why do you want to come to this medical school? What is it about our course that you particularly like? Make sure you prepare for this, because it's going to come up. It would be daft not to. You should be able to nail these stations. And know your personal statement, because some places will say, on your personal statement, you said this, tell me about it. You can also be asked what makes a good doctor. So these are just like some examples of qualities that you might be asked about. When have you shown leadership or compassion? And you'll have to give an example. They might also ask you, what makes a good doctor? Why are you going to be a good doctor? And then you can include these examples as well. Ethics, again, will definitely come up. These are some things that you should know about ethics. These are like the main topics. There's loads of websites online that tell you what you need to know for interview. The 4 pillars of medical ethics, some of you will have heard of that, some of you might not. That's fine, but you do need to know it for your interviews. They are basically just like 4 things that you can consider when making ethical decisions. So definitely look into the 4 pillars. Professionalism, again, comes up a lot. Read the GMC, so the big governing body of medicine. They've got a few documents on professionalism that you should read. Consent and confidentiality come up a lot as well, so be familiar with those concepts. Resource allocation comes up slightly less, but thinking about things like mental health services, very underfunded at the moment. How could we overcome that? Those kind of questions can come up. And decision making. So they might ask you to prioritize patients. They might ask you what you do in a certain situation. You have to make a decision. But this really, out of everything in interview, is the one that you'll have to prepare for the most. Some universities will ask you to do a role play. A lot of people are really scared of them. I don't think role plays are that bad. They could be medical, so you could be asked to talk to a patient about their long-term illness. They could be ethical, so they might sort of mix an ethical station with a role play, and you have to talk to your consultant who's drunk on the job and try and explain to them why what they're doing is not appropriate. You might be asked to break bad news. So like traditionally it's you've run over your neighbour's cat. How are you going to approach them and tell them that their cat's now dead? That kind of thing. And personal interaction. With role play, the main thing they're looking at is how you interact as a person. Are you friendly? Do you maintain eye contact? Do you actively listen to the person? These kind of things. And there might be some other ones as well. Some universities as well have very strange interview stations, so just be prepared. Make sure you've gone through loads of different questions that you find on the internet, loads of question banks everywhere. The point of them is to try and throw you off and see how you cope under pressure. So in all interview stations, the most important thing is just staying very calm and confident. Some examples are Sheffield asks you to play the game 21 questions, where you ask 21 questions and guess the object the interviewer is. Some places ask you to interpret artwork. They might give you brain teasers, you know, how many pages are in the average book, these kind of things. And yeah, they might ask you to talk to a patient. Interview top tips. So interviews are to test your communication skills more so than your knowledge. They already know you're clever because of your A levels and your UCAT, but they want to see, are you going to be a good medical student and doctor in terms of communication? Don't ever worry if you don't know the answer. You can just move on to the next station, especially if it's an MMI. I got offers from some universities after like having absolute mares and messing up stations. So really it doesn't matter if you mess up one station. As long as you do well every other station, you're fine. And if a university tells you to prepare a topic, then please do. Let's say they've asked you to read the good medical practice document from GMC, make sure you do, because they're obviously going to ask you questions on it. And always be confident and calm. Even if you're screaming on the inside, make sure you just look lovely and confident on the outside. They'll believe it, and then they'll be like, yeah, this person's great, let's go. Also, they listen to so many different people's answers. They'll probably have seen like 100 people that day. You want to just be really confident in case they're not listening brilliantly to you. If you're very confident, they'll just be like, yeah, this person knows what they're talking about. That's fine, we'll move on. So thinking about what comes next, hopefully you guys get all your offers that you're wanting, or at least one offer for medicine. You then choose a firm and insurance offer on UCAS. So you have to reject offers if you've got multiple. Your firm is like your top choice, so the one that will just get confirmed if you get the grades for it. And then your insurance is like your second choice. Usually your insurance needs a lower grade boundary, because otherwise you'll get rejected from both if you don't meet the grades, if you've just chosen two with the same grade requirements. But that'll become obvious. Like, some people get a bit confused about this, but when it comes to the time for you to do it, you'll be fine, you'll understand it. You'll need to choose accommodation. So thinking about, do you want private accommodation, university accommodation, halls, a house, whatever. Student finance, just so you're aware, if you're a UK student, you'll be eligible for student finance for the first 4 years of your degree. If you're an undergrad, it's a bit more complicated if you're a grad. And then your final year or final 2 years are paid for by the NHS. You get an NHS bursary. So you'll need to apply for that over summer. You literally just go on the student finance website. It's all pretty self-explanatory. You might choose a gap year, you might want deferred entry if you're not wanting to do medicine. You apply for deferred entry when you apply initially. So yeah, and if you do, I have a slide on it. Yeah, if you don't get an offer, there's some things you can do. You can reapply next year. You're allowed to reapply to most medical schools twice before they don't let you apply again. So you can always reapply, it's fine. You can also ask universities that you've interviewed at or been rejected from for feedback. So they might give you your interview feedback. They might say, we rejected you because of your UCAT score or whatever. Most of them will give you feedback. So that can allow you to strengthen your application for next time. Graduate medicine is an option, so you do a different degree, maybe biomed, for example, and then apply for either postgraduate medicine or undergrad medicine. It's up to you. Grad medicine's more competitive, but you might also not want to do a whole like another year longer for the undergrad degree. It's up to you. Course transfers, they don't really happen anymore. They're pretty rare, but some universities let you start like biomed, and if you're in the top like 10% of students, you can transfer to medicine after the first year. I don't actually know any university that does this anymore. It used to be pretty popular like 5 years ago, but yeah, it doesn't really happen as much now. But you can research it if you're interested, or you can consider another career path. So in particular, physician's associates, very similar job to medicine. And yeah, so you could do that. Usually with physician's associates, you do a different degree and then do like a 2-year transfer scheme thing to get into it. You're not a doctor, you're slightly like lower than a doctor, I guess, but you're doing a very similar job if it's more the job that's interesting to you than like the leadership and everything. And they're much less competitive and shorter training. There's also things like the medicine apprenticeship scheme that are kind of popping up. They'll be incredibly competitive at the moment, and we're not really sure what they're going to look like. So you can consider those if you want, but I wouldn't say have them high up on the list. And finally, just a couple of top tips for medical school. I just wanted to include this because hopefully all of you are going to be medical students one day. And from someone who has almost finished medical school now, these are just like my top tips, things that I think are beneficial. Go in having an open mind. I meet loads of sixth formers who want to go into medicine and they're like, I'm going to be an obstetrician. I wish I didn't have to learn the rest of medicine. Don't go in thinking like that. You're going to not enjoy the whole course. You're not going to enjoy the 5 years because you're only going to have like 2 weeks on obstetrics. And you might come to obstetrics and absolutely hate it. So yeah, go in with an open mind. Don't narrow yourself in like into a hole and tell yourself, well, I'm not going to enjoy anything else. You will be surprised. Everyone's mind changes about 1 million times. I've gone into placements where I've thought, yeah, I'm going to hate this placement. It's not for me. And then by the end of that placement, I'm thinking, wow, that was an amazing placement. I am considering it for my future. So yeah, always have an open mind. Don't box yourself in. Always get stuck in. If you have opportunities to do things, always agree to them. Even if you think it's maybe not for you, give everything a go. If someone says, you know, we're doing communication skills, for example, and they're like, who wants to volunteer to have a practice? Get stuck in, it's going to make you better, help you develop your skills. Ask loads of questions to everybody. Don't ever feel like you can't. Everyone is really friendly in medicine. We don't mind at all. Even things like, oh, why did you choose that specialty? I'm struggling with this. Can you give me some advice? No one minds. You ask loads of questions. Help each other. This is so important. Lots of medical students and doctors suffer with their mental health quite badly. I'm just going to be honest with you guys. Be kind to each other. If someone's struggling, offer help. I was always taught that like when you're a doctor and you hand over jobs to each other, always ask things like, is there anything that's going to be worrying you tonight when you go home? Are you going to be able to sleep? Because if they're worrying about something, they can maybe share that with you and make them feel better. You know, are you safe to drive when you go home? These kind of things, because if you ever lose a friend who studies medicine or is a doctor to anything like mental health related or stress related or tiredness related, then it's quite difficult. So just look out for each other, be really kind, ask for help if you're struggling as well from the university or from your friends. Yeah, look out for each other. Also with this, like, we all want to pass medical school at the end of the day. It's not a competition. So yeah, just help each other out. Don't compare yourself to others. A lot of you will go into medicine from being the cleverest in your class, and then you'll go into medical school where everyone is incredibly clever. Some people have done previous degrees. Some people are like 40 years old. Don't compare yourself to them. You've got into medical school. You're still great. It doesn't matter that you're not top of the class. One day you will be top of your field, it's fine. Yeah, don't have like imposter syndrome and things. And be proud of yourself. It's difficult to get into medical school. If you've got there, then that's great. And if you make your whole way through medical school, that's an achievement. Just be kind to yourself and be proud. And enjoy it. Hopefully you all go into medicine for the right reasons, and hopefully you enjoy every placement you go on and look forward to going in every day. But yeah, just enjoy yourself, have fun. So that's the end of the presentation. I am sorry it was very long. I will answer your questions now. I know there's a couple in the Q&A box. Any more questions, please feel free to put them in the Q&A box and I'll work through them now. Let me just stop sharing so I can see the Q&A box. Okay, so questions I've got at the moment. How feasible is it for someone to enter medical school after a bachelor's degree? It's very feasible. A lot of people in Manchester actually were graduate medics. It's completely up to you, basically. If you're ready to do another 4 or 5 years of university, then go for it. You won't be alone. There will be loads of grads on your course. Yeah, it's very, very common. I know medical students who are in their 40s. So yeah, 23 is not old at all to be joining medicine. It's just personal preference. If you don't want to go through that amount of training, you could consider something like physician's associate roles and degrees. But yeah, it's very feasible, especially if you did well in your previous degree. When people live as a group, how do they decide who cleans the toilet or kitchen? So I guess it depends. Like when I was in halls in first year, we had like rotas and things. We had a cleaner for like communal areas, but our kitchen was always a tip, so our cleaner would never clean it. Yeah, so we had rotas, and same in when I lived in a student house. I live alone now because I didn't really like living in a student house, but yeah, we had rotas when I lived in a student house as well, I think. But mainly like would be like, oh, on this day we're going to clean the kitchen and the like living area. So we would all help and we just like divvy it up between us. And then we had multiple bathrooms, so different people were in charge of different bathrooms. But a lot of people struggle with that. A lot of people have fallouts. Just like try and encourage everyone to get involved, I guess, and then that makes it easier. And just clean more often, especially if you guys ever live alone. Clean as often as you can. Like if you make a mess on your side, just clean it up straight away, and that makes your life so much easier. But yeah, a lot of people find it stressful. My sister's currently just moved to university and she's hating sharing kitchens with other people, so but it's all part of the university experience, and like you look back fondly on it. So yeah. Oh, essays done in Oxbridge, as far as I'm aware, yes. From the Oxbridge medics that I know, they write a lot of essays, like 3 a week or something ridiculous. So I think Oxbridge do still use essays. They definitely did a couple of years ago. They have a lot of lectures as well, and they have less discussion groups. The MMI stations, again, so basically there's types of MMI stations you can get. You'll tend to have the first one will be like motivation for medicine. So they'll ask you, why do you want to do medicine? Why do you want to come to this university? Those kind of questions. Then there's usually a station on work experience. So what did you learn on your work experience? Give an example of team working on your work experience. What was something that you thought could have been done better on your work experience? These kind of questions. You'll probably be asked 1 or 2 ethics stations. So that can be literally anything. You might be given very ethical questions. You might be given ones like, how is social media used as a medical student? What are the risks and things? You might be specifically asked, you know, what's the relevance of autonomy, one of the pillars in medicine? What other stations can you have? Manchester ask an extracurricular station, so like, how do you have a life outside of A-levels, this kind of thing? How will you have a life outside of medicine? Why is it important to develop coping strategies? I'm trying to think if there's any others. Yeah, there's usually a role play station, which could be anything from ethics to breaking bad news. And there could be an academic station where they ask you to do like drug calculations. That's the most common thing. Or they might give you like a graph, and then you have to like look at the graph and say, oh, this is what it shows. You can also be given articles and asked to interpret the article. There'll be more interview surgeries and crash courses and things from 6med nearer the time. So when you get your interview offers, I would go to those, and they'll talk more in detail about how to answer each of those questions. So hopefully that was helpful. Is maths A-level required for medicine? No, I didn't do maths A-level. I did biology, chemistry and geography. I'm very glad I did geography. I think it's actually more relevant to medicine than maths is. Most people do biology, chemistry and maths, or physics, chemistry and maths. But yeah, it's not required. If you don't have it, it doesn't matter. Also, like, you don't really do any maths in medical school, or like as a doctor, you only do quite simple like drug calculations. They're not that difficult, to be honest. I've never struggled with them. So no, it's not something to worry about. The only required subject is chemistry. I don't think it's required everywhere, but usually chemistry is required. Biology is useful as well, I would say. But yeah, maths not that useful, so don't worry about it if you don't have it. How much do extracurricular activities or EPQ matter when applying to medicine? EPQ doesn't matter really. Most medical schools won't consider EPQ in terms of like lowering grades and things, because not everywhere offers EPQ, not every school offers EPQ. So medicine has a lot of making sure it's fair for everybody. So they often don't consider EPQ in terms of like grade wise. The only thing you can use it for is exploring motivation for medicine, talking about what you're interested in, which is a very short part of the application, to be honest. So if you have the opportunity to do EPQ and you're not that excited about it, don't feel that you have to for medicine. I didn't do one. And fourth A-levels as well, they often don't take into account fourth A-levels. Extracurricular activities are much more important, because you can absolutely be asked to interview what hobbies do you have. Work experience as well, very, very important. Just have things that you enjoy doing. Like, not every extracurricular activity needs to give you a certificate or a qualification. Just say like, I like going on runs because it helps me de-stress, that kind of thing. They really like that. So extracurricular activity is very important, but EPQ isn't. But yeah, anything you enjoy doing is really relevant. If you like art, that helps like with just dexterity, and that can be relevant to medicine. And languages, whatever it is, whatever you enjoy doing, it's relevant. But yeah, definitely have some life outside of medicine that you can talk about. I only have one more question, and I will answer it in a sec. If you have any more questions, pop them in the Q&A. If not, feel free to leave. It's fine. Hopefully this was all useful for you. Yeah, just so you guys are aware. So currently doing my undergrad degree at a university located in Scotland, and the aim of the course is to grow possible candidates to enter medicine as through the postgrad medicine entry pathways. I feel that my A-level grades are AAA, and I think might reflect. So most medical schools only want you to have 3 A's at A-levels. They don't usually care about A stars. I think like Oxbridge do, I think Birmingham does, but like most medical schools only need 3 A's at A-level anyway. So having 3 A's, like that won't negatively impact you. International applicant, it's more competitive to get in as an international applicant, but not impossible. It really depends how well you do in your undergrad degree. You really want to be getting a first or a 2-1 minimum. You want really good like work experience as well. What else do you need? Just like, you really have to show that you're really passionate about medicine and really go out of your way to build all your experiences. But yeah, just do well in your degree, I suppose, is the key thing there. And just look into what each medical school want from their applicants as well. So they, like quite a lot of places, like grad medicine schemes, they don't look at A-levels anyway, they just look at your degree. So yeah, just look at what they want really and just do what they're asking you to do and you should be fine. But yeah, AAA, it probably won't affect you. What will be more competitive is your entrance exams. So it depends what course you're trying to get into. Your UCAT, your BMAT or GAMSAT, I think. They still use, so whatever it is, you want to score really well with that. And that'll more affect your application than your A-level grades. I hope that was helpful. But I think it's still feasible for you to get in, just work really hard, basically. It'll still be very competitive. And if postgrad medicine schemes aren't going, like you don't think you're going to get in, you can also apply for undergraduate medicine as a grad. You just have to do 5 years or 6 years instead of the 4-year courses. They're much less competitive for grads to get into. Any more questions from anybody? If not, feel free to leave. I hope it was helpful. I'll stay till 10 past if no more questions get added in the chat, and then I'll end the session. But if you have more questions, I don't mind staying a little longer. That's okay. I hope it was useful. And there'll be more surgeries coming up as well that you can join. That'll be more specific. This was really the overview. But yeah, each topic will be covered separately anyway. So I hope that was useful. I'm not really sure what you're asking, I guess. Likelihood of saving a place in your uni graduate entry medicine program. Like, I don't really know what you mean by saving a place. It's exactly the same as applying for an undergrad course. You just apply. They're probably not gonna prefer you just because you went to their previous degree necessarily. I mean, maybe an interview, but generally not necessarily gonna prefer you. So yeah, you just apply like a normal degree, and it's just very competitive basically. If you go online, you can see the proportion of places given to different types of people, so international and home students, for example, and you can see how many people applied. So you can kind of see like the likelihood of getting in. Usually it's about 10 applicants per place for medicine, but it will vary between universities. Most of them release their like statistics. And if you look at those, that can give you an idea of how likely you are to get in. Any more questions from the last 4 of you who are still here? I'll give it another minute. If BMAT's no longer used, what exam will be used instead? So we don't really know. So the BMAT thing was only released to the media a couple of months ago. We could kind of see it coming. BMAT was becoming really unpopular. I also agree that BMAT not a good test for potential medical students. I don't think it really tests anything different to GCSEs and A-levels. But they haven't released what they're going to replace it with yet. So we know like Leeds and Lancaster, they use BMAT at the moment. They're likely to just adopt UCAT because they're kind of UCAT university vibes, I suppose. But otherwise, we think Oxford and Cambridge might come up with their own exam, because I don't think they're going to want to use UCAT because they're still very traditional. And UCAT is a bit more testing skills of like MMI, PBL universities use. So I think Oxford and Cambridge will develop their own admissions tests, maybe together, maybe separately, but most of the others I think will take UCAT. So that's a prediction. I don't know for sure. I don't work with those universities. So, but I think UCAT will be more popular, and I think Oxford and Cambridge will have their own exams. But we will see. And the problem, I suppose, will be that none of us tutors will have ever taken those exams. So it's going to be a bit more tricky for the people who do have to take those. But we can expect the grade boundaries maybe be lower because everyone's new to it. I'm guessing it'll be similar to BMAT if Oxford and Cambridge do release their own ones. I think they'll have a similar layout. But yeah, I'm not sure for sure, but that's what I predict. How many days you consider need to perfectly prepare for your UCAT to ace them with like 850 average? So it's really difficult with UCAT. There's no way of guaranteeing yourself to get something like 850. You don't need 850 to get an interview at medical school. I got 730 average and I was in the top 10% of my year group. So I got offers from 3 of my universities, I think, by the end of it after interview. So yeah, you don't need 850. You probably need to revise a lot if you want to get 850. And part of it is kind of luck, really. Revision does help, but yeah, it depends on the day. Time management is going to be the big factor onto what your score is. So yeah, it depends. So when I did mine, I revised all summer. So my exam sort of at the end of my summer break from school. I revised pretty much all summer, almost every day, but probably not every day. And I just did 10 to 15 minutes each day of like a short blast of questions. And then nearer my exam, I started the mocks that are on the UCAT website because they're on a computer, so you can actually get used to the format and the shortcuts with the keys and things. But I would say you need to do like short but often, really, and do them for quite a while, do them for a few months so you can get used to them, because the questions are kind of strange. Some people are just naturally good at them. Things like abstract reasoning, people struggle with, like the pattern recognition is quite difficult, and the verbal reasoning is quite difficult as well because you are expected to read a lot in a short amount of time. But you know, if you're good at maths, you'll do well on the mathsy one. I mean, I got like 890 on the mathsy one, so I'm not brilliant at maths, so it's possible. But just with abstract reasoning and things, if you're not inclined to be good at it, then you can kind of struggle a little bit. But I wouldn't put yourself under pressure to get something like 850 because it's not necessary. And once you get into medical school, like most of us don't remember what our scores are. I only remember because I have to check regularly because I do a lot of tutoring and people ask me a lot. But as soon as you get into medical school, it doesn't really matter. So just do as well as you can, and hopefully you just get a good enough score. I would say if you get over 700, that's a pretty competitive score. I know people who got in the mid 600s. So yeah, but little and often, because if you just try and cram it, you're not going to get any better. Just like, yeah, little and often, and try and use UCAT's own past questions and mocks, because they are what you're going to be asked on the day. Whereas some, like if you pay for subscriptions for questions, they're often not exactly like what you're going to do. But yeah, 15 minutes a day for just over a month probably is good. But no cramming as well before the exam. You need to go to bed early rest well and things. Because yeah, time management and speed and things is the most important part of scoring a good UCAT score. I hope that's helpful. Any more questions? If not, then you can leave. And then I know that I'm not ending it while you're typing. Would there be possibilities where UCAT would not be used in the near future by any chance if I'm in year 11? I would say probably not UCAT. I think UCAT is going to be used for a long time. It has been used for what, like 10 years or something now. So, and it's very popular. I don't see a point where medical schools will get rid of admissions testing. Because it is useful for them, because they get so many applications that they need to have a way of filtering through them based on kind of like IQ, I suppose. So I don't see that UCAT will ever not be used, but yeah, it would be quite far in the future. The only thing I can think of is if universities start just doing their own admissions tests, and like part of the reason would be like cost, because you do have to pay to sit UCAT. And you have to sit UCAT every time you apply. So if you didn't get in this year, you'd have to resit your UCAT. And so I know some universities don't feel comfortable making people pay to come to medicine because they want to be more fair. So that's the only reason I could see them getting rid of UCAT, but I've not heard anyone say anything about that. And I wouldn't expect it to happen within the next few years. I'd be very surprised. They've also like recently kind of revamped UCAT, so that makes me think as well they're not getting rid of it soon. But if you're in year 11, you could even, it's like, start considering looking at UCAT now and just doing like every weekend a couple of questions just to start. The longer you give yourself to revise for it, the better you'll become, the more used you'll get to the questions. If you buy one of those books off like a used book website that are like 5,000 UCAT questions, you'll never get through all the questions, and you can just start getting used to the types of questions that you're going to come across, and that could be quite useful for you. But yeah, don't stress too much about UCAT. Just go in and do your best, and most people do better than they think. I definitely did better than I thought I was going to. So yeah, don't put too much pressure on yourself. But yeah, you probably will be setting UCAT. Any more questions?